Governor Inslee, thank you for taking my question. My name is Jim Demain. I live in downtown Seattle. There is significant social isolation of vulnerable seniors living in nursing homes who aren't really ill, but they're not allowed visitors because of the current pandemic. Many of these seniors are not skilled in video messaging or modern technology. So my question is, how should these facilities be supporting these isolated seniors, and how can their families and loved ones better connect? Are the families and patients getting transparent updates about the status of the epidemic in nursing homes? And do we have any hope for modification of visitor restrictions in the next few months? Currently, families and visitors aren't really able to visit.
Yeah. Well, listen, these are the folks that need us most, and sometimes the most difficult to have that connection. You know, we have found the telephone works with most folks in these circumstances, and we do have an expectation that the people who are caring for them will help facilitate that, get the phone up to the person's ear, make the phone call. You know, the folks in these facilities are busy, but that's something we ought to reasonably expect to help them to do. And just that one phone call can make, you know, the whole day a good day. So obviously that is something we got to maximize. The letters, the cards, the gifts, the flowers outside, the waving to people from outside through the window. I got to tell you, it's been my experience that those things can just mean everything to people, even though they're relatively small gestures. So we certainly hope people can continue to do those things. There is a reasonable requirement on the facilities that they do accommodate those communication needs. We do expect them essentially by law to provide that kind of service to people because it's so important to their mental and their physical health. We have had a very concerted effort to work with our long-term care facilities so that they can be disciplined in that and rigorous to do that as much as humanly possible. The visitor issue is really, really a hard issue for us because we all know the power of touch, to be able to hug someone we love. There's hardly anything that is more restorative and hopeful than that physical touch. But that right now is just too dangerous. It is just a scientific reality that we have to face, that the risk of allowing these viruses to get in these facilities is just too potentially fatal for us to allow right now. So for the immediate future, we're going to have to continue to have that policy, difficult as it is, until the rate of the spread of this virus is decreased so that the probability of that getting into a nursing home has been reduced significantly. And I wish I could tell you exactly when that's going to be. It's something we monitor on a daily basis. It's also one of the reasons why we're so intentional of getting more testing. Look, we need to be able to test thousands and thousands of more people than we have capability of testing right now. And that's why John and I and our whole team are trying to help the federal government to be more vigorous, to really build up the manufacturing capability so we can get these test kits to everybody who needs them. I was on the phone yesterday with multiple companies searching for a way to buy more test kits so we can test more people. If we can test more people sooner rather than later, we might be able to release these visitors restrictions earlier. And you may have heard me urging the president to be more vigorous in his efforts in this regard. And that's one of the reasons why, because the more we can test, the more we can release some of these restrictions. So I hope everybody can find somebody to help in these long-term care facilities, find any gesture, no matter how remote, because folks certainly need it.
Secretary Weissman?
I would agree with the governor, and I would say when we get to that place too, where we can start relaxing some of our restrictions, life is still going to be different. And I would imagine in our nursing homes and assisted living facilities that when we get to that place, we're going to restrict still the number of visitors. We're not just going to open it up widely to begin with. We got to make sure we really get past this risky stage. So we do look forward to the day where we can relax some of those, but I also want people to understand that that still will look different, and we need to be prepared for that. We'll want the governor's really encouragement of manufacturers to manufacture these personal protective equipment, the masks, for example. You know, I could see us when we do allow some visitors back in a restricted manner of having them have to wear a mask, but that also means we need to have the masks available. So we need to stay connected during this time now. We look forward to that time when we can ease the restrictions. It isn't right now. And just preparing people, it will still look differently when we come out of this for a while.
All right, thank you. Let's go to the second part of the question.
And finally, do we have any hopes that we will have surveillance at some point in the next few months so that we'll actually be able to test and see the prevalence of disease and then be able to ease restrictions over time? Thank you very much for taking my question.
Great, thank you. Oh, go ahead, Gov.
No, go ahead, John.
I'll start by saying, as the Gov said, we are really trying to increase the number of tests that are available out there so everybody who should be getting a test can have that. I will say we are working right now with the Centers for Disease Control and Prevention and doing some additional testing as well to just see what the prevalence of this is. I've told you earlier that we know some people have the infection without even knowing it, ever developing symptoms. We would like to know what percentage of folks out there have had this infection. That will help us with our data as we look at the path forward and our ability to remove some of these restrictions. So everybody's working really hard to get as much testing as we can, and there are new kinds of tests that are going to be coming out as well that will add some capacity and give us quicker results. We really need people being able to get results essentially the same day that we test folks. That's the ideal and the place we are trying to get.
Yeah, I'll give you a sense of why we have more work to do. Last week, we had to have a person who works for John drive from Seattle to Spokane to pick up 40 vials and test kits to deliver to Yakima, where there's a bit of an outbreak in one of these homes. And it was just a window of how critical these supplies are and why we're so dedicated to increasing them. We're doing everything we can in the state of Washington. We think we might have found the availability of hundreds of thousands of these swabs that we need, but they need to be validated. And I'm spending a good part of my time helping in that effort. But again, I want to reiterate, this is a great job for the federal government. Look, the federal government mobilized the entire manufacturing base of the United States in World War II. And this generation, or at least some of this generation on this call, remember World War II. And Franklin Delano Roosevelt mobilizing every manufacturing company in America to get involved in this. We really need the same kind of effort right now to get these companies to make these products, vials, swabs, machines to do on-site testing. And I'm really hopeful that the federal government will become much more dedicated to that task. We have to have this national effort. Our people depend on it.